brachial plexus injury MCQ discussion. In the last snippet, we have talked about the brachial plexus injuries. We have also briefly discussed about the branches of the various cords of brachial plexus. I've given you the mnemonics. And apart from that, we have discussed 3 diseases which are complete, total or global brachial plexus baby, Erb's paralysis, Klumpke's, actually 4, Erb's paralysis, Klumpke's paralysis, and injury to long thoracic nerve. So based on that, I found 3 MCQs which are clinical MCQs. And so I thought of discussing these MCQs. So a request from my side is that as I read the MCQ, read it along with me, but don't see the answer. Pause the video, try to attempt the MCQ yourself, because then it gives you a complete understanding whether you have really understood the topic or not. Like, to check the comprehension of any topic, I think, according to me, the best way is to read or listen to a lecture, followed by that, solve the MCQs of that topic. So moving on to the first question. I'm going to follow the reading style of MCQ as per our DAMS pathology faculty, Dr. Sanjeev Chitragar sir. His technique of reading MCQs and how to attempt the question even if you don't know the answer. So I'll be reading the last line of the question first, then I'll be reading the options. So based on the options, I'll get a idea about from which topic has this MCQ been set. And after that, I'll not be reading the whole question. I'll just be reading the key words of the question and mark the answer. That is the technique. So let me show you how this technique practically works. Which of the following is the most likely cause for the man's current symptoms? Dorsal scapular nerve, long thoracic nerve, upper subscapular nerve, suprascapular nerve. Okay. Okay, so first of all, I come to know that all are nerves. Second thing is all are nerves of the upper limb. So this is brachial plexus. So the question has come from brachial plexus. Okay. Now, important key word in this is only one: prominent right scapula. We have learned it in our previous snippet that prominent scapula is nothing but injury or winging of scapula, which occurs due to injury to the long thoracic nerve. So the answer to this MCQ is option number B, long thoracic nerve. What was the root value of long thoracic nerve? C5, C6, C7, also called as nerve of Bell or nerve to serratus anterior, because it supplies that muscle. And because serratus anterior muscle is paralyzed, loss of pushing and punching actions and partial loss of overhead abduction. Second question. So which of the following is the most likely etiology for the boy's current symptoms? Now here, the one word that is important is that he was born by spontaneous vaginal delivery complicated with shoulder dystocia. I want you to highlight this word, shoulder dystocia. Secondly, left arm adducted and internally rotated. Internally rotated is nothing but medially rotated. So these two words, shoulder dystocia and left arm adducted and internally rotated, I have told you in the previous snippet that if there is a birth injury, any 3 of the following can happen: global brachial plexus baby, Klumpke's, and Erb's paralysis. But you have to first think about Erb's paralysis. It can also be global brachial plexus baby, but for that all the functions should be lost. Like there should be loss of flexion, extension, abduction, internal rotation, everything should be lost. Here only adduction and abduction is lost. That's why there is adduction. So that is why being a birth injury, I would first suspect Erb's. So because of that, the answer is Erb's paralysis. And Erb's paralysis, I have told you, is mainly by C5, partly by C6. Lesion to the upper trunk of the brachial plexus, which is formed by C5, C6. So the answer to this question is option number C, C5, C6. And moving on to the last MCQ of the day. Which of the following muscles is most likely denervated in the patient? Climbing muscle, boxer's muscle, pectoralis minor, and forgotten muscle. Okay, so this is a good question. So anybody preparing for anatomy quiz, we have an anatomy quiz next month. You should be prepared with such questions also. So climbing muscle is your latissimus dorsi. Boxer's muscle is serratus anterior. Forgotten muscle is subscapular. So now I know that all the muscles are from the upper limb. So this question is about upper limb. Okay, now let me go ahead. Abnormal prominence of the right inferior angle of scapula. So abnormal prominence of the inferior angle of scapula suggests again winging of scapula. There is a prominent medial border, the prominent medial border of scapula, and therefore the condition is winging of scapula, injury to the long thoracic nerve, nerve of Bell, nerve to serratus anterior. So which muscle will be involved? Serratus anterior. Serratus anterior is also called as the boxer's muscle. So the answer to this question is B, boxer's muscle. I hope you have liked the selection of the MCQs. I purposefully select clinically oriented questions and not just recall questions, because in clinical questions, you can really discuss some other things. Also question reading skills and arriving at an option despite not knowing the answer taught by our DAMS pathology faculty is of great use, and you can put that in clinical questions. However, you can't use that technique in a one-liner question. So I hope you have liked the video. If you have liked the video, share, subscribe, like the video, and any suggestions, please mail us on our Quizzing Society email ID, bvideomcquizingsociety@gmail.com. Thank you.